Now for next up, we'll get to look at the prognosis for chronic kidney disease in children. So prognosis of a disease is you are looking at the likelihood of a patient recovering from that disease. Okay, so for chronic kidney disease in children, okay, because chronic kidney disease is into different stages. So the likelihood of you becoming stable in the disease depend on the stage where the disease is at. Right? Depends on the stage in which the disease is at. So prognosis of chronic kidney disease in children just depend on a lot of factors. So you are trying to look at what actually caused the chronic disease in the child. Can the thing be removed? You are trying to look at the stage at which they first discover the disease condition. You are trying to look at, is this child, did they first had access to better healthcare systems or not? Okay, so how well was the complications first being managed, or are you the first to start management? So general progression overview, progressive nature. You should know that what chronic kidney disease is something that is going on over time, right? So at any stage that you catch it, you have to slow the progression. You have to prevent complications. Okay, so if it is at the end stage, of course, dialysis and transplantations are the only things you can do. Then survival rate. So children with this end-stage renal disease have a 10-year survival rate ranging from 70 to 90%, but this is significantly lower than healthy pairs. So quality of life, it affects how they grow, affects how they are able to visualize things, affects their psychosocial well-being. Okay, so complications that impact prognosis, that's what would depend, like what the prognosis depend on. So cardiovascular disease, so if there's associated heart issues, bone mineral disease, if there's associated bone issues, anemia and fatigue, there's associated blood and weakness issues. Psychosocial challenges, so if they are having all those emotional issues, social difficulties, all right, all of this could actually lead to further complications there. So factors that improve prognosis: if you have early on picked the disease and you have started treatment early on, nutritional support and growth monitoring, access to specialized pediatric nephrology care. Okay, the kidney transplant, if they have access to kidney donation, is compatible, they have the money for transplant. So all of that actually makes the prognosis better. So these are all the factors that actually influence prognosis for chronic kidney disease in children.